In a significant step towards marking National Cancer Survivors Month, Apollo Cancer Centers, ACCs, today announced the launch of CanWin, a cancer support group that brings everyone together in their cancer journey. CanWin, a name that embodies two powerful ideas: there's a can in cancer, a quiet reminder of strength and possibility, and there's win, not just a destination, but a mindset. A decision to rise with grit, grace, and determination.
Newer technologies. Currently, we cover the country with 73 hospitals spread across the length and breadth of the country. And our chairman, Dr. Pratap C. Reddy, always mentions that a patient should not be deprived of any treatment. If it is available in any part of the world, it should be available in India. And that's what started this organization 41 years back. He said if a patient can be treated in US, he or she should also be treated in India with the same standards or even better standards.
A patient with breast cancer is not only about removing the tumor or prescribing therapies. The treatment has to be more holistic. We also need to treat not only the physical ailment, but also the mental agony that the patient goes through when they are diagnosed with cancer or even when they are going through the disease. And this, I think, is very important to have a support group wherein in this group there are people who have gone through the same experience, the same fears and same amount of uncertainty. And when they are together with each other, the synergy is amazing.
I'm Dr. Neema Bhatt. I'm a consultant hematologist. So I'm a person or doctor who treats blood disorders. I do bone marrow transplants and also treat children with cancers. So I'm dealing with a set of very specific, very sensitive, naive patients who have not really been through much therapy. They've not really been through much in life, especially when I talk about children who are being diagnosed with cancer. If any of you know any family or a child who's been diagnosed with cancer, we know as the oncologist for that particular patient that I'm not diagnosing just that child. I'm sort of putting a diagnosis on the entire family. So because family, friends, the whole community is sort of involved, especially when it comes to caring for a child with cancer. And as Dr. Jayanti rightly said, we're not trying to treat just the disease. We're trying to treat the patient as a whole. And when I'm talking about a child with cancer, we're treating the family as a whole. It's not just one person, it's the whole entity which is the family. So in the bare minimum of 15, 20 minutes, 30 minutes that we get, to break the diagnosis, to talk about the medical part is only not enough. So imagine talking about the entire psychosocial aspects that come with it, the repeated follow-ups that come with it. Both our adult and pediatric patients who are diagnosed with blood cancer usually require treatment for about 1.5, sometimes up to 2 years, with a lot of repeated visits to the hospital. Despite that, sometimes we're looking at 90% cure, sometimes we're looking at maybe 70% cure depending on how severe the disease is.
2 years back, and one evening, I felt heavy bloating and heavy sweating and also a little bit of breathlessness. Then immediately we rushed up to a cardiologist in Sakra Hospital. They did all the tests regarding to my heart, but all those heart related tests were very normal. So doctor said, because you are having bloating problem and also low hemoglobin problem also was there, so he suggested us to consult gastroenterology department in Sakra. Then we went there and they conducted endoscopy and colonoscopy. In endoscopy, they found a tumor in my stomach, which is malignant tumor, which is very close to 4th stage. Then we came home and met my doctor friend, Dr. B.M.K. Reddy, who passed away recently, but he was working as a radiologist in Apollo Hospital. He saw my reports And immediately he arranged a meeting with his colleagues in oncology department. Then we had a great discussion about my disease, but that discussion and meeting gave us a clear picture of what is my disease and what type of treatment I should go. That was really a blessing to me.
ಅಪ್ರಿಷಿಯೇಟ್ ಮಾಡಿ ಭಯ ಪಡಬಾರ್ದು, ಎಲ್ಲ ಸರಿ ಹೋಗುತ್ತೆ ಅಂತ ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟು ಡಾಕ್ಟ್ರು ಎಲ್ಲ ನಮಗೆ ವಾಸಿ ಮಾಡಿದ್ರು. ಇವಾಗ ನಾನು ಚೆನ್ನಾಗಿದ್ದೀನಿ. 18 ಕೀಮೋಸ್ ಮುಗೀತು. ಯೂಟ್ರಸಲ್ಲಿ ಓವರೀಸ್ ಕ್ಯಾನ್ಸರ್ ಇತ್ತು, ತುಂಬ ದೊಡ್ಡದಾಗಿತ್ತು. ಅದೆಲ್ಲ ಚಿಕ್ಕದು ಮಾಡಿ ಆಪ್ರೇಷನ್ ಮಾಡಿ ನನ್ನ ಚೆನ್ನಾಗಿ ಓಡಾಡಿದ್ದೀನಿ. ಐ ಆಮ್ ವೆರಿ ಆ್ಯಕ್ಟಿವ್. ಎಲ್ಲ ದೇವರಂತ ಡಾಕ್ಟ್ರು ಎಲ್ಲ ನನಗೆ ವಾಸಿ ಮಾಡಿದ್ರು.
My journey with breast cancer started as of this January, so I'm just 6 months, not even 6 months old in this. And yes, it has changed my life in more ways than one. 2025 didn't start on a right note for me. I think not for many of them it did, as we're seeing it now. I noticed an unusual discharge, and like everybody does, goes to Google to get answers, and it didn't set right. So I reached out to my sister who is in Apollo, Dr. Kalpana, and she put me in the awesome hands of Dr. Jayanti Tumsi, and she immediately put me through a mammogram, and that was what was advised, and immediately followed by a biopsy. When the biopsy was done, the doctor looked at me and said that this doesn't look very promising. It looks like a case of mastectomy. I didn't understand. Obviously, I didn't expect something like this, and I was like, English, please, because I didn't understand the word, or it didn't hit me.
Yeah, hi, I'm Shahina. I'm a cancer warrior. Basically, because I have won the cancer, I'm not afraid of it anymore. Yes, at that time I was. 2 years back, I survived it in June, the same month. Today I'm smiling. That's only and only because I'm out of it. And yes, I was brave. And to fight it's not easy. It's not an easy journey. But cancer is not about me.
My name is Sundar Rajan. I live in very close to IIM in Bannerghatta Road. So I've been diagnosed with the stage 3 cancer. And my only request to the people who are listening or watching this video, don't need to scare about cancer. The moment you've been diagnosed with a cancer, I think you need to approach the right doctor, and with all the reports, you need to go through the reports with the right doctor, have the counseling, and then take it forward. And there is no one size fits all, which means that there is no one cancer treatment will fit you for other cancers also. So be careful, and also go through a second opinion if required, to be confident on what you are going through, and there is no need to worry.
Hello all, I am Dr. Vishwanath, Senior Consultant in the Department of Medical Oncology at Apollo Hospitals, Bangalore. Today I am extremely honored to be a part of this CanWin program, which has been initiated by Apollo Hospitals, which basically is our patients coming up with real stories which they have faced, and they are our true champions, ambassadors. They have gone through chemotherapy, surgery, radiation, and have come out victorious, and are able to talk to the world about what they have faced. And it's not only about that, it is a real celebration for them to celebrate this victory and joy for having fought this dreaded disease. I congratulate all my patients, and I congratulate Apollo for coming up with such a novel program. Thank you.